Hello people, in this video we want to look at this case study. A 6-year-old girl presented with pain abdomen, joint pain, pain in the fingers, toes, on and off since 5 years. She's only 6 years and from 5 years she has all these complaints which she had jaundice before. Hemoglobin 8 kind of for child, is this okay? WBCs are fine, platelets are fine, reticulocytes are more. Reticulocytes are increased. Look at the blood picture. Blood picture, definitely you can see very clearly that there are sickle cell RBCs, right? So you can see some sickle cell RBCs here, right? So definitely it looks like a anemic picture. So it can be sickle cell anemia, correct? Now, let us look at the diagnosis. Diagnosis, we are saying it is sickle cell anemia because the hemoglobin is less. But what is the hemoglobin range for a child? Write 2 points in favor of your diagnosis. Other specific tests to diagnose the condition and its complications of sickle cell anemia. For child, the normal range is around 11. So yeah, this is mild anemia for the child. So what are the tests to diagnose this above condition? What are its complications? So basically, let us look at sickle cell anemia in this video. So usually this can be a inherited disease, okay? Like it can be autosomal recessive. So it's an inherited disease. Then here what happens in chromosome 11? In chromosome 11, in the DNA, in the coding, GAG will become GTG. So in the RNA, GAG will become GUG. This is the coding strand. Remember, in the coding strand, GAG will become GTG. So in RNA, GAG will become GUG. So glutamic acid will be replaced with valine in the 6th position in the beta hemoglobin chain. So the RBCs will become sickle shaped. Now what happens if they are sickle shaped? Their oxygen carrying capacity will reduce, correct? So then, here you can see pleiotropy. Some of the RBCs are round and some of the RBCs are sickle shaped. So this is a codominance. What else you can know here about sickle cell anemia? The manifestations can be anemia, then vaso-occlusive episodes, microinfarcts, macroinfarcts, then how will you detect this? Also they have given, hold on, we'll come to that. In heterozygous, if it is heterozygous, then it will be sickle cell trait. But if it is homozygous, then it is sickle cell anemia. Because heterozygous won't have that much issue, right? So if it's homozygous, it is sickle cell anemia. Double heterozygous states will be sickle cell disease. What is this double heterozygous? Double heterozygous means combination of this condition with other hemoglobinopathies. Combination with other hemoglobinopathies. Then it will be called as sickle cell disease. Okay. What else you should know here? Why exactly the sickling happens and all that. Now, mechanism of sickling. Let's look at this. Sickle cell anemia. The mechanism of sickling. C-I-C-K-L-I-N-G. During deoxygenation, the red cell containing this is a special hemoglobin called as sickle hemoglobin. Sickle hemoglobin this is. They change from biconcave disc shape to elongated crescent shape. So instead of becoming biconcave disc, they become crescent shaped. Right? So this is during deoxygenation. During deoxygenation, this happens. The process is called as sickling. It occurs within the intact red cells and in vitro in free solution. Okay, so the RBC becomes crescent shaped. Okay, so did you understand what you understood? There is an RBC, in that there is hemoglobin. When this oxygen is released from this hemoglobin, what happens to the hemoglobin? It forms rod-like polymer. These rod-like polymers, they align, and when they align, the RBC itself, they will distort. So some polymerization, rod-like polymer, they align and distort the RBC. So just go back here and see what exactly are the questions they have asked. What is the diagnosis? Write 2 points in your favor. What are the specific tests to diagnose this condition? So the specific tests to diagnose this condition are something like sickling test. So you have the lab diagnosis of sickle cell anemia. Basically, you can check the hemoglobin levels. There could be anemia, right? Moderate to severe. Then the smear, when you take the blood smear, peripheral smear, you can see the sickle cells. You can also see some target cells, Hubble, Jolly bodies, etc. You can see. Have you seen the target cells here? See, these are the target cells. Target cells, you can see so many target cells, beautiful target cells, like how you want to shoot them in the center. Then what else you can do? You can do a sickling test. Okay, we'll come to the details. Then you can check for hemoglobin, which has S-type hemoglobin will be there. Then cytogenetics, you can check that the chromosome 11 has some defect, right? Beta hemoglobin chain, 6th position will have the mutation. Now, how exactly is sickling test done? If oxygen tension is less, the hemoglobin RBC will become sickle shaped. Okay, this biconcave disc shape RBC will become sickle shaped if it has this hemoglobin S. So how you will do? You take this sodium meta bisulfite. Okay, on this sodium metabisulfite, you add 1 drop, very little drop of whole blood, and then cover it with a cover slip and then observe it under microscope. This sodium metabisulfite will reduce the oxygen tension, hence the RBCs will become sickle shaped. That's all is a sickling test. Then you can, that's all right, sickling test also over. Now sickling increases, you know, when sickling increases if the oxygen tension is low, if the temperature is more, if there is leukocytosis, even if there are bacteria, the sickling can increase. Now last question they have asked here is the complications of sickle cell anemia. Look at this. So this guy has sickle cell anemia. Now what and all you will see in this guy? Anemia, obviously anemia, you'll see aplastic crisis. It's trying to make so much blood. This guy is prone to infections. He has microinfarct because of this, which he will have abdominal pain, chest pain, joint pain, etc. because of microinfarcts. Because the sickle cell, they can't flow properly. They'll get stuck everywhere. They'll call infarcts, ischemia. He's prone to infections, abdominal pain. He can have hematuria. Macroinfarcts will cause all these problems with kidney and all that. Stroke can be there to the brain. Retina is damaged. Ischemic necrosis of bone damage will happen, right? Acute chest pain he will have, that we told you in microinfarct. And we have also seen in the case it's a jaundice, right? Jaundice. So basically what you see here is the vaso-occlusive phenomena. So there are infarcts. What infarcts? Microinfarcts and macroinfarcts. Microinfarcts and macroinfarcts in sickle cell anemia. So we are done with this case study. We have covered the specific tests, complications, everything we have covered. So this patient itself has the symptoms: abdominal pain, joint pain, pain in fingers, toes, history of jaundice. Everything is whatever we have discussed, we have already explained. Okay. See you in the next video. Bye bye.